hair care, the need for transplants, and the mental health aspect of hair loss. These are the three subjects covered in today's documentary. All of the advice given in this documentary is backed by doctors, is certified by medical professionals, and it features me actually visiting a hair transplant clinic and sitting through a hair transplant procedure.
It looks like a hair transplant हो जाना है, but when you actually saw this is...
I'm not able to talk then.
Hair loss isn't rare anymore. 85% of men experience hair loss.
When I also used to visit places with my friends, I was feeling a little uncomfortable to click pictures and everything.
So, even if you're not dealing with hair loss, feel free to only consume the hair care section.
I'm really nervous about whether will I get my hair back.
I can promise you can imagine yourself what you were 7-8 years back.
I hope you watch it till the end because this is our index of chapters. But if you're only here to understand hair transplants more deeply, skip to this timestamp. If a tattoo is 10 out of 10, what is the pain level? This is the ultimate documentary when it comes to the subject of hair, and it's only the second documentary by Team Beer Biceps. Men all over the world are trying to make their own confidence levels shoot up by dealing with this receding hairline problem first. Minoxidil is higher in demand than ever.
So what is minoxidil? It's basically a topical solution that you apply to your scalp. It helps stimulate the hair growth by increasing the blood flow to your hair follicles. Follicles are tiny pockets located just beneath your skin. They supply the hair with nutrients and are essential for healthy hair growth. Topical minoxidil is one of the most commonly used FDA-approved treatments for early hair loss. It improves blood circulation and prolongs the hair growth phase. For those who can't tolerate the topical form, low-dose oral minoxidil is a great alternative that also helps reduce hair fall and boost density, but it should always be taken under a medical supervision.
According to a 2025 market report, minoxidil sales have jumped in the last couple of years, especially through online platforms. But if you speak to most qualified dermatologists, they'll tell you that minoxidil is simply a temporary solution for this problem of receding hairlines. Most men who are dealing with receding hairlines eventually, when they can afford it, opt for a hair transplant. Hair, that's the theme for today's video. That's the problem we're trying to sort out in today's video. We had hosted Dr. Abhishek Pilani on the show some time ago. Gave us a fantastic episode on hair transplants. Thought I'll actually go visit his clinic. I'll actually sit while he's going about a hair transplant, interact with the patients. How are you guys feeling?
All good.
Thank you for having us here. Mainly, this video is for men all over the world. It's not just an Indian problem. It's a global problem.
Early days, we were seeing this kind of problem seen in people who are 30s, 40s, late 40s, 50s. Now we see a lot of patients in early 20s also having this problem. Going bald, frontal is receding, crown is receding, and everything is because of the aggravated lifestyle modifications that we see.
Medical tourism to Turkey has increased because it's become the hair transplant capital of the world. Until now, according to the Towards Healthcare research paper published in May 2025, India saw over 3 lakh hair transplants in 2024 alone. That's one hair transplant every 2 minutes.
A lot of people go to Turkey for hair transplants because of the hype and medical tourism. But what they don't realize is that in many centers, the procedure is performed, often done by technicians, in a single long day. Safety and results can be compromised in the process. In India, especially in reputed clinics, doctors perform the entire procedure themselves with full skill, multiple sessions, and zero shortcuts. There is no over-commercialization. The approach is personalized, safer, and more ethical, and also the results match up to the global standards.
Say 70% of our patients now, we have our overseas patients. They are flying from the US, UK, all of that.
If you had to get a hair transplant in India? How much would it be roughly?
Cost is very subjective here at Assure. We have different segments of doctors. If I talk about in terms of Indian rupees, so it would range between 2 lakhs to 15 lakhs based on the complexity as well as the surgeon's seniority who's doing it.
If you're in a tough spot where you're unsure, if you're anxious, if you're just tired of feeling judged by the society around you, take a breath and listen to what the older guys, the experienced ones have to say. They've been through it too, and they're here to help you. We help each other. That's how human society should be built.
I started losing my hair in my late 20s. I'm 46 today.
You know, there's like a lot of younger guys especially dealing with like hair loss related problems.
Yeah, it's more challenging for them, especially if you're looking for a life partner. So you have to work harder on your confidence because you know that you have to compensate that this is missing.
What did you learn on a life level from this whole process?
Don't start blankly using products just by looking at it or somebody's showing an ad on Insta or something. Don't do that. Do good research. Take multiple opinions from doctors.
Can we talk about the hair transplant also?
Yeah, of course.
The first time you did, you said you got it done in Chandigarh some time ago.
Yeah, 8 years ago. It wasn't only the doctor's vision at that time. At times, 19 bhi ho sakta tha. But now, the same doctor does it. Meaning, he removes the grafts and he plants the grafts. I think that is one of the best things because he knows what he's doing. His vision is intact.
Firstly, let's talk about something basic but super important. Hair care. While I've covered some very common mistakes, there's a bunch of tiny hair guidelines that we've covered in our past videos. I'm just going to list some of these guidelines around me in this particular frame so that you can pause the video, take a screenshot and get a lowdown on habits for healthy hair. Are you ready? In 3, 2, 1, take the screenshot. And now we're moving on. Always imagine that your hair is like a tree. The scalp is the soil. And just like a tree, if your roots are weak, the rest will eventually weaken.
Dandruff is one of the most common hair health concerns among men worldwide. It is often the first red flag when it comes to early signs of balding. Over time, dandruff can clog the pores on your scalp, cause persistent itching, and weaken your hair at the root. So the first step to fix the foundation, if you're dealing with dandruff, always use a good quality anti-dandruff shampoo. As per a 2018 study, anti-dandruff shampoos, whether they contain traditional antifungal agents like selenium sulfide or zinc pyridine or natural compounds like DPG, have proven to be effective in managing dandruff and improving the scalp health.
So if you're dealing with this problem, firstly, tackle dandruff. Secondly, for the dandruff problem, keep your pillowcases, your helmets and your caps and hats clean. That's where the bacteria exists. Next, try avoiding scratching your scalp because that's going to do more damage in the long term. And now if you're someone who uses hair products often, here's a quick breakdown of how they actually may be messing around with your hair just a little bit. Hair serums, they make your hair look shiny, but most are packed with silicones. Overuse may lead to clogging, especially if it trickles down to the surface of your scalp. So if you want to use hair serums, make sure you're only applying it on the body of your hair and not the scalp. Next, hair masks, they definitely help in moisturizing your hair, but they don't fix hair fall. Same rule, if it trickles down to your scalp, it's going to cause a problem. Next, gels and wax, fantastic for styling. I end up using gel and wax pretty often, but you need to take a lot of care of your hair. If you're dealing with these products, you need to ensure it doesn't touch your scalp. You need to wash it off. You need to remember that these products dry out your hair. They do speed up breakage if you're already dealing with some kind of hair loss. So style smart, but also take care of the trees on your head. Next, hair color. Most permanent hair colors contain ammonia and peroxide, which strip your hair's natural pigment and weaken the cuticle. This leads to thinner strands, dryness, and long-term fragility when it comes to your hair. Blow drying, again, you're adding a lot of heat to your hair. If you're regularly blow drying your hair, even on low settings, it breaks down the protein in your hair, takes away the moisture, and especially if you skip heat protection, eventually this will lead to split ends, dryness, faster breakage. And next time when someone says, This works for me. Just remember, what works for one scalp may not work for another. Hair is subjective, it's personal, and most importantly, hair doesn't just need styling, it needs protection as well. Now, when it comes to one of the biggest Indian hair care tips out there, I myself have always recommended that you oil your hair regularly. Of course, if that oil is left on your hair for very long, it will cause damage to your scalp. It will trickle down to the surface and may clog your scalp. I've asked multiple qualified dermats the same question, and I've always found that people are divided on this process of oiling one's hair. I do believe that it's extremely subjective. What works like magic for someone may harm someone else, but the truth is that enough scientific research has not been done on this process of oiling one's hair.
If someone is already experiencing hair thinning or baldness, oil cannot reverse that or help with new growth or density. The main role of oil is to provide a bit of moisture on the scalp. Medically and scientifically, oil doesn't play any active role in treating hair loss. But yes, in Indian tradition, oiling has always been a part of the routine, more as a cultural habit than a treatment.
Is there any way to grow your hair longer, faster?
See, again, a lot depends on the genetics, right? A lot of people naturally have very fast hair cycle where it grows really long. Some people struggle to and they don't. Good nutrition definitely overall helps the hair health, but again, there's no magic for the hair to grow longer otherwise.
When you say good nutrition, you're referencing good protein intake, good hydration?
Yeah, everything, a balanced diet, right? And obviously, a lot of people nowadays you see have deficiencies, like there's a D3, B12 deficiency, iron deficiency in women is so common. So all of that, obviously regular blood work and getting those deficiencies corrected is important.
Can you also just give me 2 or 3 like superfoods that you can eat for healthier hair?
So nuts, something which everybody can start their day with, almonds, walnuts, chia seeds, all of that. Avocado, nowadays people want to add in their meals, so that can be done. But high intake of protein, of course, like paneer, for vegetarians especially. Tofu, all of that is great.
When it comes to the process of hair loss, you may be doing everything right and you still find that you're losing hair. Why? Because most of the time, as is the case in 2025, our genetics kick in. In some cases, it's not just the genetics, it's lifestyle factors as well. All of this leads to something called inflammation. Inflammation is related to the heat within your body. The body is basically in fight mode most of the time. Constant stress, toxic food, poor habits. They're all triggers for your immune system to go into a defensive mode. Now, when your body is truly inflamed, your scalp isn't getting the kind of blood flow that it needs. It's not getting the kind of oxygen that it needs. And that messes with hair growth. In most cases, excess internal heat in the body, according to Ayurveda and even modern nutrition, is down to lifestyle factors or diet. Now, this excess heat in the body usually shows up on your face and your scalp. Acne, dry skin, rashes, or hair loss. So, what's the long-term game plan in order to reduce the rate of hair fall? Basically, keep your body healthy and your hair will also stay as healthy as is possible according to your genetics. So as far as possible, fix what's inside and it'll reflect on the outside.
Balding doesn't occur overnight. It progresses in stages. The most common form of hair loss in men is called androgenetic alopecia, and it typically follows the Norwood scale, which maps 7 stages of hair loss.
If we simplify this further, there are 3 major levels of hair thinning that most men fall into. Let's call it TLT: thinning, loss, and damage. The first level is thinning. At this stage, hair loss is subtle, a bit of shedding, slight hairline changes. This is usually seen in people in their late teens to mid-20s, but it can happen earlier too. It's often triggered by stress, poor sleep, dandruff, or bad lifestyle habits like junk food, smoking, or irregular routines. You'll notice more hair on the pillow, but your friends probably won't. This is your best chance to take action. This is the point where you can begin basic treatments like minoxidil. You can add some kind of scalp care to your routine like anti-dandruff shampoos, gentle oiling on the body of your hair for moisturization purposes. And if you also work on lifestyle factors like diet, or if you quit smoking or reduce your alcohol consumption, you're usually on your way to recovery. The second level, loss. The hairline's clearly receded, the crown's thinning, and the overall density feels lighter. Styling your hair becomes tricky. And if you find yourself checking your hairline constantly, this stage commonly affects men in their mid-20s to their early 30s, especially those with a family history of baldness. This is where consistency with treatment becomes everything. At this stage, many choose to opt for a proper hair care combo of minoxidil and finasteride, obviously only when guided correctly by a qualified dermatologist. Now, as per the Indian Dermatology Online Journal's research paper, minoxidil stimulates hair growth and finasteride temporarily blocks DHT, dihydrotestosterone, a hormone that's believed to be one of the contributing causes to male pattern baldness. It's not too late, but you can stop the hair loss at this stage. These factors can slow things down or maybe even regrow what's left in some cases, but you need to be guided by a qualified dermat. Now, the third level, damage. This stage usually hits men in their 30s and beyond. The crown is mostly visible, the hairline's faded by this point, and the middle area may have completely thinned out. By now, your shampoos, oils, and serums are just maintenance, they're not cures. So what's the real solution in this case? A hair transplant. Now, if you've got the resources and you're looking for a permanent solution, a hair transplant might be worth considering. But here's the thing. You're going to have to invest your time, money, and some patience as well. We're talking about confidence growing back quite literally, strand by strand.
So he's Rishabh and it's day 1 of his procedure. So I would like to explain how we design a hairline on any patient. That's the most aesthetic part about a transplant. So first thing is, aesthetically, face is divided into 3 equal parts. That's from the chin to the tip of nose, from tip of nose to the glabella, the midpoint, and from the this to the central part of the forehead. Okay. This is the main lowermost point on the forehead. This is the distant center part. This is the sideline. So this distance from the lateral eyebrow to this point would be equal on both the sides. Now the shape of this line would almost match with the angle of the jaw. Okay, that will match with the structure of the face. And the most important comes the crown part. Now if you notice over here, in the crown, every individual, it is a whirl pattern, like a whirlpool. Yes. So we have to make sure that we implant the follicles in these angles and directions in the circular pattern so that it matches with the natural density.
How are you feeling, bhai?
Yeah, just kind of nervous because how the procedure goes, and I'm really nervous about whether will I get my hair back. That's normal.
That's a normal anxiety, but I can promise you can imagine yourself what you were 7-8 years back, and that is what you'll be seeing yourself in 26.
No, you'll kill it.
I work in a kitchen, so it was mostly because I used to wear my cap a lot. So I felt like that was probably one of the reasons where I started losing hair, or my hair thinning started from there. But also other thing what was I feel was smoking, when I feel that maybe it impacted somewhere.
How old are you, brother?
25.
25?
Yep.
We'll be concentrating on the areas. We divide the donor area into 3 parts for day 1, day 2, day 3, and accordingly. We'll be giving local anesthesia over here along with the tumescent fluid. Along with tumescent. So basically it's a combination, it's a mixture of a fluid where we use 90 ml of normal saline with 8 ml of lignocaine, that's a local anesthetic, short acting, and 4 ml of bupivacaine, which is long acting. It's a combination along with 0.5 adrenaline. So that anesthetizes, plus we make the skin prominent, which will help us to extract the follicles from the roots. A small prick. I just extracted around 400 follicles. We'll extract more later.
400 follicles?
Yeah. How do you count? So that is, they'll be counting now. We'll be doing around 1,000 to 1,200.
How are you feeling, my bro?
Fine.
You all good?
Yeah.
You felt anything?
No, just like the first prick felt like my first time I got the tattoo.
First time you got a tattoo?
Yeah, the same thing.
It feels just like a tattoo.
Nothing, yeah, not even like a tattoo though, just like a small.
Okay. If a tattoo is 10 out of 10, what is the pain level here?
6 in the start, 6 or 7. No.
Just the anesthesia?
Yeah.
Okay. We're taking a bit of a 10-minute breather right now. It's a medical procedure, so for the doctors, it's very normal. But obviously, if you're there as a non-medico seeing it, it takes some time to wrap our heads around.
When you listen this in a podcast, it looks like normal, hair transplant ho jata hai, but when you actually saw this is
Takes some time. See, the truth is, it is an invasive procedure, but it is painless. Like, I've had some painful tattoos inked on myself, and he said that it was only 60% of that pain, which probably is nothing. Like a tattoo from a good tattoo artist just feel like someone's taking a pen and drawing on your skin. So yeah, glad to be bringing this content for you guys. So I'm not able to talk right now. So that's what a whole hair follicle looks like.
Yeah, so we've recorded a single unit, double unit, triple unit, what I was mentioning, how we'll be spreading it single unit in the first line, then transition zone, then second and the triple.
To make it highly simplified, this is like tree replanting, right? Like you're pulling out trees from one location and placing
Yes.
it in another location.
Yes. Normally we have something on the screen.
Like you'll be able to speak.
Yeah. I have patients who do their office work. I have some patients who play video games, some watch matches.
Feeling all good like a tattoo.
I still believe tattoos are more painful.
You don't mind us being here. How are you feeling, Abhi?
Keep chanting Om Namah Shivaya. So,
You're just moving on with your
yeah,
procedure.
just keep doing Om Namah. Whenever I'm anxious, I keep doing Om Namah Shivaya and I just, all these center words.
We've only spoken to guys today, and I think it's so important to have a girl also speaking about this problem. Because there might be a lot of girls who are silently suffering.
They are. A lot of them. Even around you, there are girls who have better hair. So, you're demotivated in that way because they are not giving us motivation. They don't understand what we've been through.
So you used to feel angered.
A little. But then, I thought that yes, this shall too pass, and then a day will come where I'll be very confident and it will work out for me.
Before going for the transplant, did you try other things?
A lot of things. I've tried different things, at-home remedies, crushing onions and fenugreek together, making a paste and just...
I had male pattern baldness, like my father. It is genetic as well. And then I have PCOS also, so it was one of the other factors. I tried everything, medicines and other, maybe whatever treatment is there for hair. And then it didn't work out.
What made you finally go for a hair transplant?
See, everything else is a scam. Yeah, because this is the only thing that works.
Hair transplant was the last option left for me.
I never saw the money side of it. I always saw like what I would get out of it.
What about guys who may not be able to afford it yet? What do you tell them?
Well, I think here, places like this, or at least this place has a lot of plans for those guys as well. Yeah, someone wants an iPhone, they want an iPhone, they grab it. So if you want this is gonna give you a whole transformation.
Do you feel life is very different post getting the hair transplant? Just in terms of how people treat you?
I have zero fear in stepping out in the sun or out in the open. It's come back.
Just feel that you can travel, you can party more. I just feel that life opens up a little bit more.
Yeah.
Oh, I use all products now, like
Yeah.
the hair products which all the young boys used to use and I could not, and I'm so happy about it.
Well, I started looking into mirror more. People appreciate you.
It's been a roller coaster ride, you could say. The decision of hair transplant was a life-changing decision.
What's your message to younger guys who are going through this?
I think no one should be scared of this. This is like almost like going to a spa or a normal haircut.
I'll just say, bro, be a rock, build yourself up, make the money, go get the transplant done.
I would just say just have a lot of self-confidence. Don't lose hope, which I did.
You keep quiet, you keep taking it, they're gonna think it's fine and they're just gonna keep doing it. But the minute I spoke up and I told them this is not okay, it made a huge difference. I really hope someone sees this and be like, you know what, it pushes them to go get it done, because trust me, it makes a huge difference.
This is my actual hair, pre-styling, and honestly, it's been the only thing I've ever been insecure about in my life. Because ever since I was a kid, I was told that my hair quality isn't great, but I'm 32 and I'm not dealing with balding, and that's when you realize the real blessing of thick, wavy hair. But again, I see your male friends going through balding related insecurities. You feel really bad. All these videos on beer biceps related to hair and skin that we've ever created have always been created keeping men's insecurities in mind. So, to all those guys who are dealing with any kind of balding right now, just know science has got your back. If you're in a position where you cannot afford a hair transplant just yet, hold your horses and remember some of the most confident men that we've seen as we've grown up in our lifetimes. Vin Diesel, Jason Statham, The Rock, Michael Jordan, Pep Guardiola, Jeff Bezos. All of these people have dealt with receding hairlines. At the end of the day, you've got to really go within yourself and understand that in the lowest phases of mental health, there's also a tiny opportunity for you to work on your mindset. So if it's a very big problem for you and you can afford it, go for a hair transplant. If you're not sure you want to go for a hair transplant, go to a qualified dermat and get some guidance. And if you're not in a position to pay for a hair transplant or to pay the fees for a qualified dermat, my suggestion to you is hold your horses, grab as much education as you can, but do not let your mental health slip away, brother. Take that excess energy that you're feeling as a result of that anxiety and pour it into the process of knowledge, pour it into the process of self-improvement. The worst case is that your self-improvement will lead to you being able to afford that hair transplant or that consultation with a dermat someday. My goal with this documentary and every episode I make is very simple. I wish to help you become a better version of yourself. Promise you that with every new episode, we'll keep raising the bar. We'll keep pushing ourselves to serve you life-changing documentaries that are going to help you grow, that are going to help you evolve, and that are going to help you upgrade your life. See you in the next DRS doc, because these growth films are here to stay.